evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Nigeria's commercial center, Lagos State, reopens its economy. Worship centers also to resume this month, but vigils not allowed yet. Federal government warns against flouting the COVID-19 guidelines in order to reduce community spread of the coronavirus. And United Nations call for nations' support for vaccinations against infectious diseases, including COVID-19. (11,166) is the number of confirmed cases of COVID-19 in Nigeria. The Nigeria Center for Disease Control, NCDC, also puts the number of patients discharged at 3,329 and the death toll at 315. Well, of the 348 new cases, Lagos has 163, the FCT 76, Ebonyi 23, Rivers 21, Delta, Nasarawa and Niger 8 cases each, Enugu 6, 5 cases each in Bauchi, Edo, Ekiti, Ondo and Gombe, 4 in Benue, 2 in Ogun, 1 each in Osun, Plateau, Kogi and Anambra states. While 71,336 samples have been tested across the country. Regional figures show Lagos in the southwest with the highest number of cases. You can also see that Lagos has recorded from the total number of deaths, 67, with 878 people who have recovered. Well, next is Kano in the northwest region, with cases unchanged from yesterday's figures at 970. The FCT in the North Central region maintains the third highest tally. Borno still maintains the highest tally of 296 in the northeast. Edo leads in the south-south with 341. Ebonyi in the southeast with 63 cases. And Lagos is joining a league of states as it announces guidelines for the reopening of the economy, private businesses, churches and mosques. In the new guidelines, churches are expected to open this June, the 21st, with not more than 40% capacity, not more than the capacity of 500 worshippers, while mosques, they are the same. They will be expected to reopen the 21st of June. Services are to operate strictly on Fridays and Sundays as night vigils are banned. The governor of the state, Babajide Sanwo-Olu, also warned that businesses who do not obey the guidelines for reopening will be sanctioned.
Operating at 60% capacity is done worldwide, and Lagos said it will come up with its own production.
We will, from 14 days' time, precisely from the 19th of June, for our Muslim worshippers, and from the 21st of June, for our Christian worshippers, we will be allowing all of our religious bodies to open at a maximum of 40% of their capacity, maximum of 40% of their capacity, and we will be working with them as being expected with the Lagos State Safety Commission. But we know that these places of worship have different sizes. But even if your 40% capacity is really so large, you cannot have beyond 500. And keeping that 40% maximum capacity, it's really, really so important, right? And no matter how big your place of worship might be, you cannot have more than 500 worshippers at once. We'll be encouraging people to have more than one service and to ensure that they keep their premises clean, disinfect before another round of worship can take place. We will also be advising that there should only be mandatory Fridays and Sunday services. All other night vigils and other regular services must be put on hold for now, until we review our current situation. Persons below the age of 15, because of how well they walk around and how they become difficult to hold down, that they should be excused from the places of worship. And citizens that are above the age of 65, citizens that are above the age of 65 should not be allowed into these places of worship.
So 19th of June for the mosques and 21st for the churches. Well, the Presidential Task Force on COVID-19 today cautioned Nigerians against flouting the additional guidelines on containing the virus in the country, maintaining that government will not hesitate to enforce compliance. The Secretary to the Government of the Federation, in his lead briefing, also acknowledged the partnership of the World Health Organization and Nigeria in the resumed trial tests. He also calls on cooperation for all Nigerians, and if and when invited, for contact tracing.
The World Health Organization, as part of the efforts to find a cure to the COVID-19, has resumed the inclusion of patients in the hydroxychloroquine arm of the study. The Presidential Task Force, however, advises against self-medication in all circumstances. As we have always urged, it is important for individuals to take responsibility. As we go into community engagement, citizens should cooperate with agents of the state governments, the local and community authorities, as well as their leaders in their communities. We have received reports about citizens refusing to help with contact tracing, as well as going into isolation after testing positive. It is in the interest of everybody that contacts are traced so as to slow down the spread. We remind the public to be aware of the guidelines set for restricted opening of places of worship, national guidelines that have been shared with the states, and we expect that protocols will be agreed with our religious leaders where states have permitted the issuance of those protocols and the setting of the relaxation on places of worship.
For the Health Minister, a lot has been said on testing kits, but all verifications carried out on them has failed, saying they cannot be relied upon. Dr. Sage Hanire used the platform to explain the agreement by the Economic Community of West African States, ECOWAS ministers, on bearing the costs of conveying diagnostic tools from China. He also speaks on other issues.
We also continue to urge healthcare workers to ensure that they are protected with appropriate personal protective equipment and continue to exercise a high index of suspicion when treating patients. This is not the time to be careless. This is not a time to take risks. But it is also a time to listen to all patients, not to send people away. You can give them at least an advice. And if you are at a safe enough distance, you will generally also be safe. To comment on the various test kits that are thought to be in use in Nigeria, especially the antibody-based test kits, I would like to advise that only 4 of those kits have been evaluated by the Medical Laboratory Science Council of Nigeria, and all 4 of them failed the validation test. None of the antigen test kit has yet been evaluated. But what it means is that results obtained from these test kits, they're not tenable for diagnostics, and they are deficient in sensitivity and specificity, and are likely to give false results and mislead people. NCDC certified laboratory in Nigeria is still the WHO-recognized PCR testing method, which give us reliable results.
The governor of Kaduna State, Nasser El-Rufai, has met with traditional rulers to discuss and map out modalities ahead of the reopening of economic and business activities in the state. Speaking at the meeting, Governor El-Rufai calls for collaboration and support of all residents and stakeholders in the state as the government intensifies efforts to contain the spread of COVID-19.
We have presented our draft plan for the opening up of Kaduna for their inputs and suggestions. And we've got some excellent suggestions from them, recommendations that will incorporate. In parallel with this, there are ongoing consultations with the religious leaders at the State House. We are also meeting with National Union of Road Transport Workers to look at how to get public transportation back and under what conditions. There are other meetings with business community to see which businesses would be allowed to operate and on what terms, what protocols, health protocols, hygienic protocols, as well as physical distancing protocols that we need to put in place to ensure that the reopening does not lead to a spike in infections, because at the heart of all our policies is the need to protect the lives of the people of Kaduna State. We are talking to private school proprietors and our Minister of Education to look at what kind of conditions precedent are necessary to be in place for us to reopen schools, for instance. So all this is going on, and our hope is that by the end of this week, we'll have a clearer picture so that we can project a date when we will go to the next phase of the easing of the lockdown.
Now, 1,322 out of 1,345 Almajiri children repatriated from different states in the north to Jigawa State have been discharged from isolation. The Jigawa State Governor, Badru Abubakar, who disclosed this in a press briefing in Dutse, the state capital, says the remaining 23 are part of the 122 that tested positive for COVID-19 but are yet to recover. According to him, the state government plans to enroll them in conventional schools in their various communities. Let's take a break now. More to come on the COVID-19 response when we return. Welcome back. Let's dissect the efforts of states to opening up the economy, beginning in Lagos. Dr. Olanlesi Osadiaye, a public health physician, joins me in the studio. Thank you for joining us.
Thank you very much.
All right. How critical is the responsibility for states, seeing as we've had the additional guidelines from the federal government?
Well, definitely it's very critical for the states because obviously the government cannot do everything. They're trying to decentralize, and the states also have a responsibility to actually do some of the things that are necessary to make sure that there's safety for all the members and every other party in the state. So it's very critical for the states to actually also be able to put in all the guidelines that the government has.
So Lagos is the epicenter.
Yes,
it's recording maybe a little over 4,000 in terms of active cases.
Yeah.
And today the governor says religious gatherings can open 40% capacity, minimum 500. Does that trouble you?
Well, definitely as of today, that is troubling. Are we ready for Lagos to open religious? You know, there's been a clamor for it. I mean, everybody wants to. We are very religious people in Nigeria generally, so there's been a clamor for it. So if we're asking, are we ready? As of today, I would say no. But then what can happen within 2 weeks? A lot can happen. People can put in all the necessary guidelines to be able to make sure that we are ready to open as religious.
We're also saying, you know, no food or communion sharing, a common dish or sharing of kettles for abolition. They should all be avoided. So it's also going to be a different way to worship in the pandemic.
Definitely. Obviously, there's so many other safety measures that have to be put in place. From stepping into the church premises, churches have to make available places where people can actually wash their hands. You have to be able to wash your hands immediately you step into the premises. They have to have temperature scanners to check your temperature before you step into the church. Everybody must make sure that the safe mask is compulsory. You know, nowadays we use chin mask. I call it the chin mask instead of the face mask. It's commonly what we see. That's not even acceptable. Everybody must use a face mask. Churches are where you sing and you say, shout hallelujah, stuff like that. That's not acceptable without a face mask. So things have to be put in place before you can go in.
A bit more of the guidelines is below 15, excuse, and then below 65, not allowed. But then you would have people who live with these, you know, young people or children and, you know, the elderly going to church and perhaps coming back with that and putting them at risk.
That you've actually said it all. They're at risk. Once you're going to church and you can expose the elderly who also may have other comorbidities to this disease, then they definitely are at risk to have the disease. Unless you, obviously, people are more aware in terms of the fact that you get home, you know, you have to take your bath, you have to do all those things. But a lot of people still don't even believe COVID exists. So how will they take responsibility for things like that?
I've just been told that Dr. David Ajibade, a general practitioner, executive director of the Brain and Body Foundation, joins us from our Abuja studios. Glad you could join us at this time. One thing that has resonated among most of the speakers at the Presidential Task Force briefing is protecting healthcare workers, and there was a lot of emphasis on training on IPC, infection and prevention control. How much awareness do you think our health workers, the frontline workers, have, especially as they battle the pandemic?
Well, I think they have a lot of awareness. I mean, it's all over the place, and of course, in Abuja hasn't been as bad as Lagos, but there have been several health care professionals who have been infected and have been tested positive. So yes, there's a lot of awareness, and it's not just about protecting themselves or protecting patients. It's also about going back into their community and their families. I know many who actually change and shower when they get back home. They don't even go into the house, maybe go to the boys' quarters or have a shower outside and leave all their clothes outside before coming in, because so as not to get infected or not to infect their families. So, and as the other doctor in the studio has said too, it's really, really important that the doctors too wear their face masks and patients too wear their face masks, because you just don't know. 40% of people simply, they are infectious even before they have a single symptom. So it's very important that doctors be aware of this, and I think they're getting aware of it.
How much do you think, Dr. Ajibade, perhaps patients' visits to hospitals are warning this period? There's also been the talk of the dangers of people self-medicating, and this is also on the fears of contracting the virus.
That's a big problem, because people go online and they watch TV and they just come up with all kinds of things. Chloroquine is a big example. People just take a lot, even before they get infected, or they suspect they're infected, and it should be clearly stated that if chloroquine or hydroxychloroquine, which is now being used in many centers around the world, is only for the treatment and not for the prevention of the disease. The other problem, of course, is with antibiotics. I mean, we Nigerians are very, very famous for abusing antibiotics. So, and that can cause major problems. If you keep on taking antibiotics, it can cause other issues, but also the whole issue of antibiotic resistance. Hopefully COVID-19 will be over, and we're going to have to still grapple with the problem of antibiotic resistance, which a lot of public health physicians are crying about. So it's very important that people understand that they should not abuse medications simply because they think it's going to prevent COVID-19. I simply like to opt for the more natural ways. We all know things that can help to improve immunity. Just going out in the sunlight, for instance, can help. Exercising in the sunlight can help with immunity, and there are other specific nutrients and vitamins that can help as well.
All right, let me come back to you, Dr. Sajay, and that is, with regards to checking compliance levels, seeing as, economies are opening up in states, what do you think the level of monitoring should be for the state government across?
Well, I think that there needs to be a task force in place. We just need to go to the market or anything to see that the level of compliance is very low with regards to all the precautionary measures that people should be taking. So definitely there needs to be a task force in place for the churches, for other areas, to make sure that people are actually complying to the regulations that are put in place. And they need to take responsibility for that.
All right, and to you, Dr. Ajibade, tell us about maybe some of the science-backed things that people can do, they can apply at home to prevent them from getting COVID-19.
So I'm always a great advocate for strengthening the immune system. And we know, I mean, there are now a lot of studies showing that the patients who have had the most severe cases, those who have died, have been those who have the lowest levels of something as simple as vitamin D. You'd be surprised. I mean, there's a study in Italy. They found that Italy, amongst all the European countries, has among the lowest levels of vitamin D. And you can see from the news that they are among the worst hit in Europe. So vitamin D is people tend to overlook it because because we think we're out in the sun, but we're not really out in the sun that much, and we're clothed a lot. So I would strongly recommend vitamin D, and it needs to be taken consistently over months to get to the level that will help to protect. Vitamin A is very important for the lungs. It's important for the maturation and development and protection of the lungs. Very, very important as well. Vitamin C. Zinc is actually being used in isolation centers and in treatment all over the world, along with hydroxychloroquine, for the treatment of COVID-19. Of course, it's in higher doses, but you can take the minimum required doses by physicians that can help. In fact, they found out that 16% of all pneumonias and lung conditions are because of a decrease or deficiency in zinc. So I would recommend those 4 nutrients for people to take on, and they're safe enough to take too.
No, I think he's covered most of the bases. Definitely, those are the things that are necessary to build your natural immunity.
All right, we'd like to thank you, Dr. Lanlesi Osajaye, a public health physician. Thank you for joining us. And also, Dr. David Ajibade, thank you for joining us on the program.
Thanks.
Now, many European countries are easing travel restrictions so people can resume travel. Turkey says it plans to resume flights with around 40 countries in June. Just a while ago, leaders around the world attended a virtual global vaccine summit with U.S. President Donald Trump also in attendance.
As the search for a COVID-19 vaccine continues, representatives of more than 50 countries, including 35 heads of state or government, have come together virtually to raise funds. The summit, hosted by the UK, aims to raise the funds to protect over 300 million children against infectious diseases like measles, polio, and now the coronavirus. British Prime Minister Boris Johnson called for donations of at least $7.4 billion. UN Secretary-General Antonio Guterres, US President Donald Trump, and African Union Commission Chief Moussa Faki Mohamed were among others who made opening remarks at the summit.
First, let's find safe ways to continue delivering vaccinations even as COVID-19 spreads. Second, let's use the networks of vaccine delivery to deliver a range of other primary health services. And third, when a COVID-19 vaccine becomes available, let's make sure it reaches everyone. Diseases know no borders.
The coronavirus death tolls in Brazil and Mexico have soared to new daily records, with 1,349 and 1,092 confirmed fatalities, even as the countries begin to ease lockdown restrictions. Brazil now has more than 32,000 deaths, while Mexico has over 11,000. Over in the Middle East, Iran has reported a second day of more than 3,000 virus cases, sparking fears of a second wave of mass infections. Despite this, Iran is continuing to ease restrictions for many in the country.
And if you have COVID-19-like symptoms, do go and do a test. If positive, go into the isolation center. Don't be afraid, and following the treatment regimen properly, you'll be on your way home in no time. It's a message from the NCDC. You can find the latest guide on their website as the center continues to work closely with state, setting up treatment centers, training health workers, and managing COVID-19 patients. Also, the World Health Organization has the latest updates on the global response to the COVID-19 strategy. It includes practical guidance for strategic action. ChannelsTV.com, our website, has more updates. You can find the latest on the pandemic in Nigeria and across the world, plus other stories. Thank you for watching. I'm Millicent Nwonka. Stay healthy, stay safe.